I'm so excited to have presented on the cognitive effects of androgen receptor-directed therapies for patients with advanced prostate cancer. This was our COG-CAP trial, in which we really compared prospectively patients who were treated with enzalutamide or abiraterone therapies for their advanced prostate cancer. This study was a labor of love that included multiple different collaborating sites, and we're so excited that we are able and have presented this data at ASCO GU 2025. In the study, patients were assigned to treatment by their treating physician, either enzalutamide or abiraterone, and we sought to really understand if there were differences in cognitive test outcomes in patients, with the primary test outcome at 3 months being what was considered most important. But we did compare these patients in terms of their objective cognitive function on these computer-based tests, as well as surveys assessing their quality of life over a total period of a year, with follow-ups happening about every 3 months. In this study, we found that there were no clinically meaningful, measurable differences on that cognitive testing at between baseline, 3 months, or even any of the follow-up time points. And there was really minimal change in these objective cognitive function over the entire year. So really, really interesting. Quality of life, as reported by patients, also quite similar and quite stable over that period of a year. And we really think that further investigation may be helpful in trying to understand if there are particularly vulnerable people who might have some more changes. But in the overall population, things were actually quite reassuring. So at the end of the day, I think the message here is that patients can be reassured that there's no meaningful short-term objective change in their cognitive function with either of these treatments. And I think that helps all of us feel a little better, whether we're taking the medications or whether we're prescribing the medications, that patients actually are probably pretty safe.